Advice for people diagnosed with hemorrhoids. Important medical disclaimer. All content on this channel is provided for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. This content focuses on lifestyle recommendations, nutrition guidance, physical activity suggestions, and general wellness tips for individuals who have already received medical care and have established diagnoses from qualified healthcare professionals. Please understand, information does not replace professional medical care. Information is not intended for self-diagnosis or self-treatment. All advice is based on generally accepted medical recommendations, but must be adapted to your individual condition. Before applying any advice from our videos, always consult with your treating physician. Obtain approval from healthcare professionals. Continue treatment prescribed by medical facilities. The channel creators assume no responsibility for consequences of using this information independently without proper medical supervision. Brief introduction. Hemorrhoids are swollen veins in the lower part of the rectum and anus. They are a common condition that affects millions of people worldwide. With proper care and lifestyle adjustments, most hemorrhoid symptoms can be managed effectively at home. Remember that hemorrhoids are treatable, and simple changes in daily habits can bring significant relief. Lifestyle. Next, let's discuss daily habits that can help manage hemorrhoids. Bathroom habits. Respond to the urge to have a bowel movement immediately. Don't delay. Avoid straining or sitting on the toilet for long periods. Don't hold your breath during bowel movements. Consider using a footstool to elevate your knees while on the toilet. Daily activities. Take short walking breaks if you sit for long periods at work. Avoid heavy lifting. If necessary, use proper form and breathe normally. Maintain a healthy weight to reduce pressure on pelvic veins. Wear loose, comfortable clothing. Sleep and stress management. Get adequate sleep to support overall health and healing. Practice stress reduction techniques to prevent digestive issues. Important, good bathroom habits are the foundation of hemorrhoid management. Nutrition. The following part covers dietary recommendations. High-fiber foods. Aim for 25-35 grams of fiber daily from natural sources. Include whole grains, brown rice, oats, quinoa, and whole wheat bread. Eat plenty of fruits, apples, pears, berries, and citrus fruits. Add vegetables, leafy greens, broccoli, carrots, and Brussels sprouts. Include legumes, beans, lentils, and chickpeas. Hydration. Drink 6-8 glasses of water daily to keep stools soft. Limit alcohol and caffeine, as they can cause dehydration. Foods to avoid. Processed and refined foods low in fiber. Excessive dairy products that may cause constipation. Spicy foods if they trigger symptoms. Remember that fiber supplements like psyllium can be helpful, but increase fiber intake gradually to avoid gas. Physical therapy. Moving on to exercise and physical activity. Recommended exercises. Walking for 20-30 minutes daily to promote healthy bowel function. Swimming and water exercises for low-impact cardiovascular health. Gentle yoga and stretching to improve circulation. Pelvic floor exercises, Kegels to strengthen supporting muscles. Pelvic floor exercise technique. Contract your pelvic floor muscles as if stopping urine flow. Hold for 3-5 seconds, then relax for 3-5 seconds. Repeat 10-15 times, 3 times daily. Focus on both strengthening and learning to relax these muscles. Activities to avoid. Heavy weightlifting and bodybuilding that increase abdominal pressure. Prolonged cycling or horseback riding. High-impact exercises during acute symptoms. Important, regular, gentle exercise improves circulation and prevents constipation. Hardening, conditioning. Next, let's discuss supportive care measures. Sitz baths. Take warm sitz baths for 10-15 minutes after each bowel movement. Use plain warm water at a comfortable temperature. Pat the area dry gently with a soft towel. Temperature therapy. Apply ice packs for 10 minutes to reduce swelling during acute episodes. Alternate between warm baths and brief cold applications, as tolerated. Environmental factors. Keep the anal area clean and dry. Use soft, unscented toilet paper or moist wipes. Please note, sitz baths are one of the most effective home treatments for hemorrhoid symptoms. Breathing exercises. The following section covers breathing techniques. Diaphragmatic breathing. Place one hand on your chest, one on your belly. Breathe in slowly through your nose, expanding your belly. Exhale slowly through your mouth, letting your belly fall. Breathing for bowel movements. Use slow, deep breathing to stay relaxed during bowel movements. Avoid holding your breath or bearing down forcefully. Coordinate breathing with gentle pelvic floor relaxation. When to practice 5-10 minutes daily for general stress reduction. Use breathing techniques during toilet visits. Apply during any discomfort or anxiety about symptoms. Important, proper breathing helps prevent straining and reduces pressure on hemorrhoidal veins. Mental aspect. Calmly now, let's address the emotional and psychological aspects. Stress management. Practice relaxation techniques like meditation or gentle yoga. Engage in enjoyable activities to reduce overall stress levels. Maintain social connections and don't isolate yourself. Coping strategies. Remember that hemorrhoids are common and treatable. Set realistic expectations for improvement. Healing takes time. Don't be embarrassed to discuss symptoms with healthcare providers. Motivation and support. Track your progress with dietary and lifestyle changes. Celebrate small improvements in symptoms. Consider joining support groups or online communities. Remember that emotional well-being supports physical healing and recovery. Finally, here are important additional considerations. Medication support. Use over-the-counter treatments as directed by your doctor. Apply topical treatments for temporary symptom relief. Take stool softeners if recommended by your healthcare provider. Monitoring and communication. Keep track of symptoms, including pain, bleeding, and bowel habits. Schedule regular follow-ups if symptoms persist or worsen. Report any severe pain, excessive bleeding, or signs of infection immediately. Social support. Educate family members about your condition and needs. Ask for help with household tasks during flare-ups. Don't hesitate to take time off work when needed for recovery. Complication prevention. Follow all treatment recommendations consistently. Seek medical attention if conservative treatment fails after 1 week. Be aware of warning signs that require immediate medical care. Important, early intervention and consistent self-care prevent complications and promote faster healing. Remember that, with proper care and lifestyle changes, most people can successfully manage hemorrhoids and return to normal activities. Thank you for watching our video. Please remember that the medical tips and information you just heard are intended for general informational purposes only and are not a substitute for professional diagnosis or treatment. Always consult with your doctor or another qualified healthcare provider before making any changes to your treatment plan or lifestyle. Everyone's health situation is unique, so what works for one person may not be suitable for another. Stay healthy, take care of yourself, and don't forget to like, subscribe, and share if you found this content helpful.